This footage contains scenes of icky bugs and epidermal rashes, which some viewers may find disturbing. Viewer maturity is advised. The most commonly reported vector-borne illness in the temperate zone. Lyme disease is an infection caused by a corkscrew-shaped bacteria, Borrelia burgdorferi. This informative video has been designed as an educational tool to help spread awareness about Lyme disease. This video will explain what Lyme disease is, the symptoms of Lyme disease, dispersion and distribution of Lyme disease, and black-legged ticks. It will touch upon the occupations at risk and leisurely activities at risk as well, preventative measures that need to be taken, how to remove a biting tick properly, the actions one should take after being bitten by a tick, and other relevant information that could help protect you against Lyme disease. Borrelia burgdorferi is a bacteria that can be found in black-legged ticks. Borrelia uses infected black-legged ticks as a vector to spread to new hosts. In Canada, populations of infected ticks are established in southern parts of British Columbia, Manitoba, Ontario, and Quebec, and in certain locations of New Brunswick and Nova Scotia. Recent studies suggest the risk of exposure to Lyme disease is emerging in Canada because the range of black-legged ticks is expanding. Borrelia has many strategies to evade hosts' immune system. They induce chronic infections by resisting antibiotics, anti-Lyme herbs, and escaping host immune responses. Lyme disease can cause a number of symptoms ranging from a relatively benign skin rash to severe arthritic, cardiac, gastrointestinal, neurologic, and urogenital manifestations. Even cognitive and psychiatric issues may develop. 80% of cases develop a red bullseye rash, called erythema migrans, from Lyme disease-infected ticks. Early symptoms of Lyme disease usually occur within 1 to 2 weeks, but can occur as soon as 3 days or as long as a month after a tick bite. If you develop fever, headache, muscle and joint pains, fatigue and a skin rash, especially one that looks like a red bullseye, promptly seek medical advice. It is important to tell your doctor when and the geographical location of where you were bitten by a tick. Not all patients with Lyme disease will develop the bullseye rash. If untreated in the early stages, Lyme disease can develop some serious symptoms. The following table shows the symptoms that can arise. Patients can encounter any combinations of symptoms, including neurological, cardiac, musculoskeletal, gastrointestinal, cognitive, and psychological impairments, and more. In Ontario, the primary vector of Lyme disease is the black-legged tick, formerly known as a deer tick. These ticks typically transmit Lyme disease to a wide range of birds, reptiles, and mammals, including humans. Ticks feed slowly, and their body gradually enlarges as it feeds, making it more visible. It usually takes 3 to 7 days for a black-legged tick to complete a blood meal. Being able to recognize a black-legged tick in all of its life cycles is essential to prevent being bitten. The life cycle of a black-legged tick is 2 to 5 years and consists of 4 life stages: egg, larva, nymph, and adult. Each stage of development requires blood from a host in order to develop. Most tick bites are painless, and therefore it is important to be able to locate and recognize a tick before it bites. While feeding, ticks regurgitate fluids into the host, and ultimately, Borrelia burgdorferi migrates through the skin and connective tissue and moves via blood. The majority of bites will not result in disease because most ticks are not infected with the Lyme disease agent. Ticks may take several hours to find a suitable place on the host to attach to feed. They will seek non-conspicuous areas of the body where you will least expect to find them. Later, while we discuss the importance of doing a tick check, don't forget to check everywhere, including those unlikely places like between your toes, groin, belly button, and hair. Both mammals and birds play a vital role in the maintenance and dispersion of Lyme vector ticks. In North America, black-legged ticks have been reported on at least 54 mammalian and 72 bird species. Dispersion is vast. Those newly infected reservoir hosts are now carriers of Borrelia burgdorferi and can transmit Lyme disease to uninfected ticks if bitten. Fertile black-legged tick females lay around 1,000 to 3,000 eggs. The female does not pass Borrelia burgdorferi to her eggs. Once larvae are hatched, they will immediately seek a host, and if that host is infected with Lyme disease, then the cycle continues. Ticks can be found in any terrestrial habitat, position themselves along paths or areas of high traffic in order to find hosts. Ticks usually come in contact with people or animals by wading on tall grasses and bushes. They may take several hours to find a suitable place on the host before biting to feed. In Ontario, black-legged ticks are more commonly found in rural areas along the northern shores of Lake Erie, Lake Ontario, and the St. Lawrence River. The following is a list of confirmed endemic regions established by black-legged tick populations infected with the Lyme disease agent. Black-legged ticks are also known to feed on migratory birds, and as a result, they can be transported throughout the province. Therefore, while the potential is low, it is possible for people to encounter black-legged ticks or to be infected with Lyme disease from a bite of an infected black-legged tick almost anywhere in the province. The following is a list of some occupations and leisurely activities at risk of encountering black-legged ticks. This is not an exhaustive list. All outdoor workers should check with their supervisor if they have any questions about possible exposure to Lyme disease. If you plan on spending time outdoors, be aware of the risk of Lyme disease and remember to search yourself for ticks on a regular basis. Black-legged ticks are the only type of tick in Ontario that can transmit Lyme disease. Ticks feed on blood by inserting their mouth parts or hypostome into the skin of a person or an animal. The hypostome has backward-pointing barbs, which provides a temporary steadfast grip. The hypostome injects a painkiller, an antihistamine to anesthetize the tissue, anti-clotting chemicals to desensitize the bite site, and, unintentionally, Borrelia burgdorferi. Ticks are most likely to transmit infection after being attached for more than 24 hours of feeding, because the bacteria requires time to migrate from the tick's gut to its salivary glands. Because of this delay, prompt detection and removal of ticks is one of the key factors of preventing Lyme disease. If an infected black-legged tick has bitten you, remove the tick quickly and properly from the body. It is very unlikely the tick has transferred the Lyme disease agent into the human host if the tick is removed within 24 hours. People who are bitten by a tick, whether they develop symptoms of infection or not, should speak to a healthcare professional. During pregnancy, Borrelia burgdorferi can cross the placenta to an unborn child. It is also transmitted to an infant during breastfeeding from a mother's milk. It can be transmitted to a person by drinking unpasteurized infected milk. Sexual transmission in humans is probable among some couples, as the Lyme disease agent has been found in canine and human semen. Safe sex is advised. Preventative measures. Wear light-colored clothing because it makes ticks easier to see and remove before they can attach to feed. Wear long pants and long-sleeved shirts. Wear closed footwear and socks. Tuck your pants into your socks and shirts into pants. Use tick repellent that has DEET. Put a tick and flea collar on your pet and check them and yourself for ticks periodically. If you frequently visit the areas where black-legged ticks are established, examine yourself thoroughly for ticks. It is important to do multiple tick checks each day. Pay special attention to areas such as groin, scalp, and armpits. Use a mirror to check the back of your body or have someone else check it for you. After being outdoors, perform a full body examination, a tick check. Prompt detection and removal of ticks is one of, if not the most effective method of preventing Lyme disease. After doing a tick check, wash clothes promptly and put clothes in the dryer on the dry cycle. It is recommended that a person who is bitten by a tick should visit a physician. However, if this is not possible for the time being, then it is important to know how to properly remove a biting tick. Prompt removal of ticks from your skin will help to prevent infection, since transmission of the Lyme disease agent usually requires the tick to be attached for more than 24 hours. Using fine-tipped tweezers, carefully grasp the tick as close to the head as possible. Pull it straight out gently but firmly. Do not squeeze it. Squeezing the tick can cause the Lyme disease agent to accidentally be introduced into your body. After the tick has been removed, thoroughly cleanse the bite site with rubbing alcohol and/or soap and water. Place the tick in a screw-top bottle like a pill vial and take it to your doctor or local health unit. They send the tick to be identified and tested for the Lyme disease agent. Establishing the type of tick, and if it is infected, is the most effective way to help assess your risk of acquiring Lyme disease. It is important to remember where you most likely acquire the tick, as it will help public health workers to identify areas of higher risk.
How to remove a tick. Ticks don't just bite, they burrow in head first. Ticks can cause Lyme disease and need to be removed as soon as they are discovered. If you do not see a tick, treat the bite like any other bug bite. Removing a tick. 1. Grasp the tick with the tweezers very close to the skin. 2. Pull with gentle, constant pressure. Pulling too hard will tear the tick and leave some behind. 3. Examine the tick to make sure all of it has been removed. Look for the tick's mouth parts to be intact. 4. If any of the tick is missing, seek medical attention immediately. 5. Save the tick in an airtight container. Do not touch it. 6. Watch the victim for several days. If signs of Lyme disease are seen, seek medical help immediately. Tips. Do not twist or pull the tick. Do not try to burn the tick. Do not touch the tick with bare skin. Check frequently for ticks in areas of the body that get moist: underarms, groin, buttocks, waist, belly button, neck, back of knees. What you need to remove a tick: small-tipped tweezers, gloves or tissue. Thanks for watching. To learn more, visit about.com.
Medical attention should be sought if any symptoms of early Lyme disease develop within 30 days of removal of the tick. Antibiotic treatment may be recommended if the tick was attached for more than 24 hours, the person had been visiting an area where Lyme disease is relatively common, or the tick is not available for testing and the patient has symptoms of early Lyme disease. The earlier the treatment is received, the better. If the initial infection is not treated, symptoms involving the heart, nervous systems, or joint can occur. Blood testing also exists, however, testing the tick directly is the recommended method because the specificity of serological tests for Lyme disease is not high. As stated before, symptoms of Lyme disease can take several weeks to occur. This is because it takes sufficient time for the bacteria to spread and reproduce in the host. For this reason, testing one's blood for the presence of Lyme disease agent has a high false negative within the first 6 weeks. It is more efficient to have the tick tested, as it can tell the presence of the Lyme disease agent so that treatment can start before symptoms occur or shortly after they arise. The following is a list of key points from this video. Remember to always perform a tick check or several tick checks to be safe. If you have a biting tick, remove it promptly and properly. Take that tick to be tested for the presence of Borrelia burgdorferi. Speak to a healthcare professional and be conscientious of any odd symptoms.